in Israel here in the ministry to set the vision for the next 5 years of health tech in Israeli healthcare system. And timing is really critical. We have learned so much after 2 years of the pandemic. The industry is on the rise and is offering us many digital health tools. We want to see how we can bring all of that together for the growth of the Israeli healthcare system. And I must say, the Israeli healthcare system is mostly public, is government funded, it's not private. And this is a key factor when we are addressing those issues. The Innovation in Health Committee is focusing on the next game changers in digital health. The right of patients for health data portability, which is the next phase of interoperability, smart and efficient use of telehealth to improve access to care, digital tools in clinical trials, and benefiting from the inherent value in AI in healthcare. The challenges healthcare systems are facing are local and global in the same time. Technology can cross borders easily in the internet age, but in healthcare, technology needs to be integrated physically and locally as well. That is one of the reasons why international collaboration is so important. We can learn from each other, we can use the technology better, and we can adapt its use to each local population. We are learning from Germany's experience in the field of digital health, the approach to AI and applications, as well as the new incentive models for digital health acceleration. Just a few weeks ago, German and Israeli experts sat to discuss data access and data linkage in health. We are committed to continue this collaboration, and together, I tell you my friends, together we will be able to achieve many things. Thank you all, thank you very much, and have a successful and a wonderful convention. Thank you.
Thank you very much, Minister Horowitz, for these insights. Would you be available for 1 or 2 questions still?
Okay.
Great. I'll keep it brief. I just wonder. You mentioned the German-Israeli Forum for Artificial Intelligence, and you gave us an idea of how advanced Israel is at this point. Can you maybe elaborate a little bit on what Germany can actually contribute in this cooperation?
Well, Germany is a very important partner of Israel in the field of health. Germany is the biggest European country. Germany has a very developed health system. Germany has a very high technological level and productive capacity. We know I visited Germany many times. In my last visit, I met with your current Minister of Health, Professor Lauterbach, and I saw from first hand your laboratories, your hospitals, your research centers. It's amazing, very impressive. And I think Germany has the environment. For instance, the area of Berlin and other areas in Germany is the exact environment where you can collaborate with Israeli startups and German companies to work together to implement many of those innovations in the German health system, which is very generous. I must congratulate you. You have a very generous health system. Your health budget is quite high. For example, in relations to our health budget is lower than in Germany. So you have the opportunities to implement many of those innovations in your hospitals, in your clinics, and we are looking forward to that. All of our collaboration with Germany in the last year, I'm a minister more or less 1 year, has been fantastic. We have an excellent data sharing, data cooperation. We are going to welcome Professor Lauterbach, your Minister of Health in Israel, in a month or so, and we are looking forward to cooperation. I think Germany, yeah, we can learn a lot from each other. There are things in digital health and data banks that we can show our German friends, and we can learn a lot from our German friends about how to support more generously and more, I think, sensitively the healthcare system, because we lack the resources in many cases. So I think we complete each other. We are working well together, and I think the future will be even great for our two nations.
Thank you very much for this insight. One final question. I remember back then when the forum was open, and you were also in Berlin for that, the dashboard you provided, or like you presented there now on your phone, I think it's very impressive. Also for our pandemic management, we relied on Israeli data quite a lot. The minister yesterday announced that one of his focus areas will also be able for future pandemics to have a much better management. So I come to wonder, how come you didn't need pandemic to happen first to actually build this? So what was the driver for Israel to actually have this data already available and be able to use it?
It's a good question. I'll have to think about it further on. I think, first of all, our healthcare system is centralized. Unlike Germany, where you have the different länder, the different HMOs, you have many of them. We have only 4 national HMOs by law, only 4. And so with 4 HMOs nationally spread, it's much easier to concentrate data. Second is that we established that system many years ago already. You can also say Israel is a much smaller country than Germany, so it's easier. We have a very good literacy rate and a very good digital level. Okay, so we have a great internet service to each and every point in Israel. People are well accustomed to use digital applications, and the HMOs in health, the 4 HMOs, were among the first corporations in Israel, not just in health, but among the first corporations in Israel to integrate digital tools in their daily operations. It saves them a lot of money. They came to the conclusion that integrating digital tools in their everyday patients, doctors, relations saves them a great deal of money. And so from there they advanced to really centralize all the data in order to spend the money more cleverly, more wisely, not to just throw money away. When you have a good data system, you can work more efficiently and have more profits. I think this is one of the reasons. Second is I think that the Ministry of Health has very good relations with the HMOs, and actually they are in part, we support them, we give them the money. So the condition is that we support the HMOs, but they have to give us the data, and they have to work with us closely in order to create a common database that will serve all the factors, all the key players in the health system. So this is why I think we have it for a long time. Again, we are very much ethnically diverse, so we have people from many countries here residing in Israel, immigrants, and so it's also, it has a lot of scientific advantages to make genetically based research and keep the data, save the data, so we can, treat the different populations according to their to the data we have. It saves us also a lot of money, and it enables us to give a better care for people based on our data. So while you don't have it and we have it, so it's time that you have it, and I think you have a different attitude now, and I guess that in a few years' time, Germany will have a much better data system in the healthcare.
Well, thank you very much for this insight. So it was a matter of smart use of resources on the one hand side, on the other hand side, also a bit of a culture of innovation. Thank you very much, Minister Horowitz, for being part of this conference today. Thanks a lot, and I myself, seeing this little bit of the window on the side, hope to be in Tel Aviv at some point in the future too again, because it's a wonderful city. Have a nice day. Thank you very much.
Thank you.